So next we have an incredible presentation, which I'm very, very excited about. And really, there's two incredible women who get the opportunity to present their work. I'd like to introduce Dr. Diane Majalad. Diane was awarded a PhD from La Trobe University. I won't say in what year because that gives away far too much. In 2020, Diane joined the laboratory of Professor Andreas Strasser, who's here with us in the room today, where her current research focus lies on exploiting cell death pathways to identify new treatments for glioblastoma multiforme. She's also the mother of three, would you believe? Three, just returned from maternity leave this week. So I believe that puts her in an echelon that I can't even describe. So I'm incredibly excited to hear
present our research program, which is focused on activating multiple cell death pathways to identify new treatments for glioblastoma multiforme. And so glioblastoma multiforme is the most common and aggressive form of brain cancer, and it accounts for around 45% of all malignant brain tumours with extremely poor patient outcomes. And so the standard of care treatment involves surgical resection of the tumour, and this is followed by post-operative chemotherapy with temozolomide and also radiotherapy. However, despite these treatment regimens, tumour recurrence is almost inevitable, and this is seen in around at around 6 to 9 months from initial diagnosis, and usually around 90% of patients display this. And so how do the tumours arise? Well, in a healthy organism, there's a balance between cell death and cell survival in order to maintain healthy organs and to prevent diseases. And so in a cell, various modes of cell death can be activated, and the pathways include apoptosis and the ferroptosis cell death pathways. And so a hallmark feature of cancer is the ability of the cells to evade these programmed cell death pathways. And so the cancerous cell can divide and grow at an excessive rate, and this can result in tumour formation. And so there are other biological processes that can contribute to the development of tumours. And so the tumours can induce blood vessel formation, they can harbour mutations, and as I mentioned, they can resist cell death. And so this is a focus of our research where we want to overcome this by activating multiple programmed cell death pathways. And so we know that the overall research strategy of the Brain Cancer Centre can be broken down into various themes. And so my research focus is to identify new brain cancer medicines. And so we can use this to activate multiple programmed cell death pathways for therapeutic intervention in glioblastoma multiforme. And so this raises the question, will targeting multiple programmed cell death pathways improve treatment for glioblastoma multiforme? And is this more effective than the current standard of care treatment with temozolomide? And so in order to induce cell death by the apoptosis pathway, there are a class of small molecule drugs called BH3 mimetics. And so these drugs are designed to bind to and inhibit the function of pro-survival proteins, triggering apoptosis. And so here we have examples of the survival proteins found in a cell, and here are the BH3 mimetics designed to specifically bind to and inhibit their function. And so we know that in brain cancer cells, they overexpress survival proteins such as BCL-XL and MCL1. And so the utility of the BH3 mimetics really does hold great promise for therapeutic intervention. And so we can activate multiple programmed cell death pathways in response to various drug treatments. And so the BH3 mimetics or temozolomide can trigger cell death by the apoptosis pathway. And Erastin is a small molecule drug that can trigger cell death by the ferroptosis pathway. And so essentially we can evaluate the extent of cell death in response to various drug treatments, for example, combining a BH3 mimetic with Erastin to trigger both apoptosis cell death and the ferroptosis pathway, where we anticipate potent killing of the brain cancer cells. And so we can assess the cell viability of the cells in response to various drug treatments. And so here we have a panel of human glioblastoma cell lines. And these cells were treated with increasing doses of temozolomide, which is the current standard of care treatment. And so we can see here that there was varying sensitivity to temozolomide following 5-day treatment with this drug. And then we assessed the effect of a combination treatment of BH3 mimetics targeting survival proteins. And so we can see that with increasing doses of the BH3 mimetics, this promoted robust killing of the glioblastoma cells. And this was more potent than the standard of care treatment with temozolomide. We also assessed the impact of a combination treatment of temozolomide with the BH3 mimetic A1331852. And so here we can see in response to temozolomide, it can promote significant cell death. However, when combined with the BH3 mimetic, the cell killing is enhanced. And we also assess the impact of activating the ferroptosis and apoptosis cell death pathways. And so here on the blue line, cells treated with a combination of BH3 mimetics, we can see that there is a dose-dependent loss in cell viability following a 24-hour treatment. And then we can combine the BH3 mimetics with Avastin, triggering both apoptosis and the ferroptosis cell death pathways, where we can see enhanced killing of the glioblastoma cells. We also carry out experiments in preclinical mouse models of glioblastoma multiforme. And so essentially in these mouse models, they emulate the disease. And we carried out these experiments in collaboration with Misty Jenkins' lab. And for this experiment, we wanted to determine if the BH3 mimetic could penetrate and accumulate into the brain. And so for this experiment, the mice were transplanted with brain cancer cells. And then after 1 week, the mice were administered with a BH3 mimetic for 5 consecutive days. And we wanted to determine the amount of the drug in various organs and, of course, the brain. And what we can see is that the drug was detected, although it was lower than other organs, it was detected at significant levels in the brain. And so now these findings guide the next phase of our research, where we aim to test the efficacy of a BH3 mimetic in combination with temozolomide, and also the combination of BH3 mimetic with an inducer of ferroptosis. And so for our work, we have many resources and collaborators that make this possible. And so we have access to a large panel of the human glioblastoma cell lines in collaboration with Kate and Andrew at the Royal Melbourne Hospital. And we also have access to small molecule drugs triggering apoptosis, so the BH3 mimetics, and also modified versions of these drugs to enhance their delivery into the brain. We also have patient-derived organoids, which are essentially a 3D model of a brain tumour grown in the lab. And so we can see here with the development of organoids derived from patient material, we can use these organoids for our downstream experiments in preclinical mouse models and also in our drug screening assays. And in a similar way, we can use patient-derived glioblastoma neurospheres. This is in collaboration with Sam and Khalil, and they will be used for in our preclinical mouse models and drug screening assays. So as you've seen, we do use a lot of preclinical mouse models for our work, and so this is in collaboration with Misty Jenkins and Ryan Cross, and also with the Brain Cancer Lab with their established mouse model as well, in collaboration with Saskia, Sarah and Jim. We will be using their models. And finally, we have a collaboration with Craig Rosenfeld, where we aim to identify potential drug candidates that can activate the ferroptosis cell death pathway, but importantly, an inducer of ferroptosis that can penetrate and accumulate in the brain. And so finally for this talk, I will acknowledge my supervisor, Andreas, and my research assistant, Iman, and also past and present members of the Strasser Lab who have contributed to this project, and also Misty, Ryan, and Melinda for all their help in our preclinical mouse model experiments, and also providing the BH3 mimetics from Guillaume and his postdoc, Jiong, and our collaborators at the Florey for their assistance with the ferroptosis assays that we've been carrying out, and of course Kate and Andrew for providing the glioblastoma patient-derived cell lines, and the core facilities at WeHi were just incredibly so helpful, and also the support I received from WeHi and finally the CAS Foundation. Thank you.
That's terrific. Thank you so much, Diane. Are there any questions from the room at all? No? And that's okay. When I look at that, Diane, and as you know, I'm not a scientist, I do know what pharmacodynamics are, thanks to Jim, but that sounds really positive. How do you move from positive today and cast your mind forward 10 years' time? What's your hope and dream in alignment with our vision, I guess?
Yeah, so I truly hope that we can just find a treatment that is pretty much, I guess, tailored to the brain cancer patients, and that can really target the brain tumours and not have toxic side effects. That's our aim. And so in collaboration with core researchers in the Brain Cancer Centre, we want to develop drugs that can specifically target the brain tumours, and so overall improving quality of life for the patients too. Yeah.
Well done. Thank you so much.